Your Medicare drug plan may look almost the same today, yet the price you see for 2027 could tell a different story. A temporary program that has been holding down premiums is ending, and the part many people may miss is that the change does not affect every Medicare enrollee in the same way. If you rely on prescriptions and live on a fixed income, the difference between a small increase and a much larger one can reshape your monthly budget. So would an extra $10 a month for drug coverage be easy for your household to absorb, or would you need to cut something else? Now, the Trump administration, through the Centers for Medicare and Medicaid Services, has announced that the Part D premium stabilization demonstration will end after 2026. It began in 2025 under the Biden administration to help stand-alone Medicare prescription drug plans adjust to major changes in the Part D benefit. CMS says insurers now have enough experience with the redesigned benefit to price their 2027 plans without this extra federal support. That announcement can sound broader than it really is, so let us separate three different things. Medicare Part D is not ending. The annual limit on what beneficiaries pay out of pocket for covered drugs is not ending. And the separate low-income subsidy, often called Extra Help, is not the temporary program being discussed here. What is ending is an additional demonstration aimed mainly at stand-alone Part D plans, the drug plans commonly paired with original Medicare. It lowered beneficiary premiums and, in its first year, limited how much a participating plan's total premium could rise. The federal government also accepted more of the financial risk if a plan's drug costs came in higher than expected. So, why was that support created in the first place? Well, the Inflation Reduction Act redesigned who pays for expensive prescriptions under Part D. Beginning in 2025, it placed a $2,000 annual cap on a beneficiary's out-of-pocket spending for covered drugs. That was a major protection for someone who uses costly medicine, but it also shifted more responsibility to the private insurers that run Part D plans. Insurers responded by projecting higher costs. Then, CMS worried that stand-alone plan premiums could jump sharply while companies and beneficiaries adjusted to the new system. The Government Accountability Office later found that, without the demonstration, average monthly premiums for people who stayed in their 2024 standalone plan would have nearly doubled in 2025. For 37% of those beneficiaries, the modeled increase was more than $40 a month. The demonstration softened that transition with premium reductions, limits on annual plan premium growth, and added protection for insurers. CMS reduced that assistance for 2026 as the market adjusted. Now CMS says its review of 2027 bids shows that Part D sponsors have enough experience to support their pricing assumptions. Administrator Mehmet Oz has described the demonstration as an insurer bailout that is no longer needed. He has said premiums will rise by less than $10 for most Medicare recipients, with many seeing lower premiums. That is the administration's projection, not a guarantee for your particular plan. And this is where the numbers can become confusing. CMS set the 2027 Part D national average monthly bid amount at $296.05. That is a technical measure used in Medicare financing, not a bill that beneficiaries will pay. The 2027 base beneficiary premium is $41.33, but that is also not a universal plan premium. Your actual premium depends on the plan, the insurer's bid, where you live, the plan's drug list, extra coverage, and other pricing decisions. The law still limits growth in the national base beneficiary premium to 6% a year through 2029. It does not mean that every individual plan's premium is limited to a 6% increase, especially after the separate demonstration ends. So who should pay the closest attention? The most direct group is the roughly 25 million people enrolled in standalone prescription drug plans. More than 31 million people receive drug coverage through Medicare Advantage plans, and those plans were not the main target of this demonstration. Their premiums and benefits can still change for other reasons, but this specific decision is centered on the standalone market. Imagine that Maria has original Medicare, a Medigap policy, and a separate Part D plan. Her current drug premium is manageable, and all her prescriptions are on the formulary. If her plan becomes more expensive for 2027, she may find a cheaper premium elsewhere, but the cheaper plan could place one of her medicines on a higher tier or exclude her preferred pharmacy. Looking only at the monthly premium could cost her more over the full year. The same caution applies to Medicare Advantage. A low premium plan with drug coverage may work well, but changing from original Medicare can affect your doctors, hospitals, prior authorization rules, and medical cost sharing. Returning to Medigap later may also involve underwriting unless you have a protected right, so compare the medical side before making a larger coverage decision. Final 2027 plan details are what will make the impact clear. Watch for your annual notice of change from your current plan in the fall, then review the 2027 options when Medicare's plan information becomes available. Medicare open enrollment runs from October 15th through December 7th. And changes made during that period generally take effect January 1st. When you compare, start with every prescription you take, including the exact dose and how often you fill it. Check whether each drug remains on the formulary, what tier it is on, whether prior authorization or step therapy applies, and whether your pharmacy is preferred or merely in-network. Then combine the annual premium with the expected deductible and co-payments instead of choosing the plan with the lowest headline price. Also look at the broader 2027 Part D limits. The standard deductible can be as high as $700, although plans may charge less or apply it differently by drug tier. The annual out-of-pocket cap for covered Part D drugs rises to $2,400. That cap remains valuable for people with high drug costs, but premiums and drugs that are not covered do not count toward it. If your income and resources are limited, check whether you qualify for extra help. That program can reduce Part D premiums and cost sharing, and it is separate from the demonstration that is ending. You can also get free, personalized counseling through your state health insurance assistance program or contact Medicare directly before making a change. Just pausing for a moment to share something important with you. We've partnered with Chapter, a service we feel confident recommending for clear, honest Medicare help. They'll connect you with a licensed advisor, compare every Medicare plan in your area, and help you save money. Most people save around $1,100 a year. It's free, and their care advocate team is there to support you even after you're signed up. Call 615-639-1937 or visit askchapter.org/money using the link in the comments below. Let's keep going. Now, there's a policy argument on each side. The administration says a temporary transition program should end once insurers can price the benefit. Critics warn that withdrawing support could expose some older adults to sharp increases even if the average change looks modest. Both can be true in different parts of the market. A national projection may show manageable average movement, while a particular plan in a particular county rises much more. Other plans may fall in price, leave the market, change their formularies, or adjust pharmacy networks. Until final plan information is released, anyone claiming to know your exact 2027 increase is getting ahead of the evidence. So, the response is not to panic and not to ignore the notice. Keep taking your medicine as prescribed, make a complete list of your drugs and pharmacies, and set aside time during open enrollment to compare total annual costs. This policy change does not erase Medicare drug coverage, but it makes an annual plan review especially important for people with standalone Part D. Your best protection is knowing which rules are actually changing and which safeguards remain. The extra premium demonstration ends after 2026, while Part D, the statutory base premium limit, the out-of-pocket cap, and extra help continue. When the real 2027 prices arrive, compare the whole plan, ask for unbiased help if you need it, and choose based on your medicines and healthcare, not a single monthly number.